So moving on, let me introduce today's speaker. Today's speaker is my very good friend, Dr. Pradeep, and he's going to talk about diagnosing and treating potential fish disease issues. Dr. Pradeep is a subject matter specialist at Krishi Vigyan Kendra, ICR Indian Institute of Spices Research, Calicut, Kerala, India. He's had enormous experience in almost all aspects of fisheries, both in India and overseas. He's won numerous awards and is a very popular speaker amongst fish farmers of Kerala. So Pradeep, welcome to AFS Talks, and I'll hand over this session to you now, please. You're still on mute, Pradeep. You have to unmute. Yeah.
That screen sharing has been disabled, I think.
Deepak, can you just take a look at that?
Yeah, enable now.
Yeah.
1 second.
Yeah.
I hope the presentation is clear.
Yes, absolutely. Please.
Clear. Okay. Now, good evening, everyone, and thank you, Mukta, once again for the nice introduction. I've been very much fascinated with the slogans, in fact, and few of the slogans, from my parent organization itself, ICR, they have a slogan, "Egg research with a human touch." And always this has been my motto, to keep the human touch. And of course, we need research which has to benefit the human beings in either a fish or anything, anything it might be. And another one, I don't know whether Deepak has taken from somewhere or not, the wisdom not in textbooks. It's very, very wonderful, actually, because what we learn in textbooks is not 100% always correct when it comes to field. And we have to, even in today's talk, I need to say that we have to apply our wisdom while dealing with fish diseases or even when treating fishes. Okay, then I'll move on to the topic, how to diagnose and treat potential fish disease problems. And I need to say this is not a totally research talk, because I have been working with farmers for the past, I need to say, around 13 years. And the experience which I have got from them, I'll be sharing with you. And it's always open for discussion. And those who are in research, of course, I think you will get some food for thought for research. So let me go ahead. Now, we all might have learned this, especially Indians. In Hindi, we would have learned this nursery rhyme, "Masti Jal Ki Rani Hai." It tells the queen of water is fish, water is her life. If you touch her, she will get frightened, and if you take her out of water, definitely she is going to die. So let me tell that towards the left-hand side, I have some healthy fishes, I need to say, and this rhyme is very much applicable when you start loving fish, or when you are with it, you will know that this is 100% correct. And I have found this one very much applicable. That is why I have shared this one. Now, if you see a healthy fish and how to differentiate it from a sick fish, healthy fish always will have its, we need to say, if it is an ornamental fish like guppy, always the caudal fin will be wide open, and its reflexes will be quite okay. Like if you give a tap on the aquarium, it will just move away. Other one will be sluggish, and of course you have all signs of disease when a sick fish, whereas healthy fish won't have those signs. So you need to know what are the clinical signs of a disease and how it occurs. And I need to tell that it takes less than 5 minutes for a healthy fish to become a sick. And this happened to me today morning also. When I fed the fishes, they were all, I have been keeping marine fishes now, and they were in quarantine tank. So I have given fish all feed, everything, it was fine. And I tried a new feed, I need to tell. And around after 2 hours or so, my daughter came back and told, most of the fish are gasping for breath and they have come to the top. So I had no other option. Soon I went, almost one was over dead. And I shifted a whole lot of fish, around 10 were there, 9 I shifted to another tank. And luckily, due to her timely intervention, I need to say, 8 are safe. And one actually got suicided. It went outside, jumped out of water. So that is the problem. It takes hardly 5 minutes or so, and we need to figure out what is the problem. And I could figure out that since they were eating feed everything, it was some problem with the water quality, and you won't have time to check ammonia or so. You just have to check the salinity and move ahead. So, and what makes the fish sick? And if you see what makes the fish sick, it is all stressors. Maybe due to overcrowding, handling. This is what I was telling. Like if you touch a fish, she'll get frightened. So if you're going to touch always, and for example, a fish in an aquarium shop, always it is subjected to handling, and within 3 to 4 days, it will get disease. So that is the problem. So overcrowding may result in low dissolved oxygen if you don't have a good aeration system, higher ammonia if you don't have a good filtration system, and always during low temperature, the immune system for fish gets suppressed, and the pathogen has an upper hand. And it is always feed, nutrition, and so on. And this POET model, we need to say that the host, pathogen, and environment is very much true. Like if always in an environment, the pathogen will be there. Otherwise it should be a sterile media also. And the pathogen, the host has to live with the pathogen in the environment. So when any one of the things gets over, say the pathogen, number of pathogen is more, disease outbreak can result. If the host immune system is suppressed, it will get infected. And of course, the environment change in like pH, though it may make a problem. So you have to be very critical with these things. Now, what is the practices which are being done in Kerala? And moreover, I think all throughout the world, this may be happening. So people know when the tail shrinks now, almost all Kerala farmers, they are very clear when tail shrinks, they have some problem. So they go for application of salt, and they apply salt, and salt for like that normal sodium chloride itself, from what we get from sea is fine. But how much do you apply? So salt has many functions. When when you apply initially, it's osmoregulatory and all. It's a stress reliever, I need to say, and its concentration is higher when you go for a treatment. So exactly you need to know what is the concentration to be used, what exactly you're going to do. And people generally tell it is a fungal infection. And when you ask them to send a video through WhatsApp or say, so we come to know that it's not a fungal infection. So general farmers believe here, whatever infection it is a fungal infection. And they go for this antibiotics usage, and even human antibiotics which are used for human beings are being used, and chemicals. And in shops and all, if you buy a fish, immediately the shopkeeper will give another blue medicine, and he will tell this you apply in case of disease. So that's a chemical, and you are going to put a chemical directly, and most of them first day itself they start putting chemicals. And when you put a chemical or any other thing, your pathogen is going to be pathogen knows that he will get adjust to that. So next time when you have a real problem with the pathogen, that chemical is not going to affect. So we need to know what are the common diseases, then identifying and treating them, and how to prevent this. So let us go about. Then this is from another aquarium shop in Calicut itself. The fish had come within 2 days. I need to say the batch itself. The day it has come, I have taken the photograph. And if you ask me, if you give this lot of fish and ask me to cure them, I have no answer. I can say 1 or 2. Why? Because a fish with infected fish at this stage is not going to take any food. So what we apply medication, what we are going to do is in water. And this is unlike any other organism, like when you poultry or any other thing, even an animal, you open its mouth and do this. Even for us, we take it orally. So what we are giving in water may not be that effective. And on the other hand, like injection, those things we cannot do because it will again stress the fish. And the whole lot, maybe around 90-95% may die. So this is the problem. This is all of this due to transportational stress, I need to tell. So that is why the fish which is produced in local market has got a higher demand. So always it is true with fish, prevention is better than cure. So what we have to do is identify the disease as early as possible and go for its remedial measures. Then it's fine. I can, even if it was 2 days before, I would have saved around 95%. But now there is no way, hardly 5% can go. So this is the situation while treating the fish. Now, if you classify the diseases, it can be communicable and non-communicable. So communicable, as you know, it's bacteria, fungus, viral, or parasites, and environmental stress. All those things come under non-communicable diseases. So that is tumor, accidental intake, that we'll deal in detail. Now I'll go by disease, this pathogen like bacterial diseases, viral diseases, fungal diseases, like that I'll be going. I think somebody is going on the screen. It's fine. So bacterial diseases, no, some markings are coming on the screen.
Yeah, I'm
Yeah,
sorry. Somebody's annotating.
Yeah.
Yeah. Please, participants, please kindly stop that. Please continue, Pradeep. Sorry for that.
Yeah. So coming to bacterial diseases, what are the most common bacterial diseases? I'll just tell, the most common I need to tell it is fin rot. So how exactly a fin rot progression occurs, that I will tell you. Because initially itself, if you get the fin rot, you can easily treat and cure the fish. But if you are missing the initial steps, as I told earlier, that you are not going to, maybe because fin rot is not that severe, you can anyhow treat the fish and maybe get it cured, but the fin, it will take some time to get it recovered and get it back its shape. So how does it occur? You can see the bloody streaks on the tail, caudal peduncle and the caudal fin, bloody streaks, streak-like things you can see. This is the initial sign, and within 2 to 3 days, the rot will start from the backside itself, and you can see a required whitey patch, and later on the tail goes away. And similarly with guppy or any other fish, this is quite evident. So now if you come to again, I told so much of research potential is there, because if you look at the causative agents in each bacteria by bacteria, if I go itself, if you look at the causative agent in all textbooks, it will be written due to Aeromonas, Flavobacteria, or Pseudomonas. So it's not a single thing which is going to infect. Maybe a combination or maybe an individual thing, but it's a fin rot and it's a bacterial infection. That is what happens to a practitioner and how to cure that one. So always a bacterial disease, I need to tell that for any disease to occur, my understanding is that generally a parasite or maybe a protozoan or anything, it damages the mucus and it tries to enter. So it makes a mucus, as long as mucus covering is there, it's a very good preventive thing from diseases entering inside. So once a puncture is there, a secondary bacterial infection can come, or a tertiary fungal infection can also come. So here in this case, bacteria is done, and always. So if you look at analyze in a disease, you may come across a bacteria, a fungal, or a protozoan also. So generally here, fin rot is caused by a bacterial disease. It's a bacterial disease, and you have to go for antibiotic treatment. The treatment I'll tell later. And what is the reason for this one? Again, all the diseases, around 90% is due to poor water quality. And moving on to the next disease, here this is Columnaris, caused by Flexibacterium columnaris, and it is also known as cottonwood disease. And some people misunderstand this as a fungal infection, because this is quite similar to a fungal infection. It is like cottony mucoid coating you will find, but if you see a fungal infection in later stage, I'll show you. In case of saprophylaxis and all, you can see clearly the hyphae will be seen. But here it's just a mucoid patch-like thing, and it is also known as saddleback disease, because the disease starts mostly from the back dorsal side. So it is like a saddle on a horse. It is known as saddleback disease also. So then cottonwood disease or mouth fungus, it is also, because the infected area generally towards the mouth, this woolly thing comes. So this is actually a bacterial infection, and which I feel is a dreaded infection, because when some textbooks they said it's not that severe, but I'll tell you later what exactly. Unless you isolate and identify, you are not able to know what is the causative agent. And generally, columnaris, it's not that severe, they say, but it's a severe infection. And for me, I always consider this as a very dreaded bacterial infection, which can spread very fast. And within 4 to 5 days, it can clear off the whole thing. So here, always, if a diseased fish, one fish is dead, it has to be removed. Otherwise, it is going to infect all other fishes. So that you have to be very careful. Now, next is ulcer or hemorrhagic septicemia. And here again, if you see, it is again like fin rot itself, we have started. It's Aeromonas, Pseudomonas. And here also you can see the bloody streaks. So, but on the body, you will have patches like this reddish hemorrhages. It is because the bacteria enters the circulatory system and it can result in internal bleeding, and that is why the hemorrhages occurred. And again, what causes this? Poor water quality or decomposing organic debris and high ammonia. These all are the I need to say the water quality parameters are the key points here. Then another disease, bacterial disease, is dropsy. Some people misunderstand it with a gravid female because the abdominal area swells up, and how to treat and how to distinguish this one. And if you see in dropsy again, it is by Aeromonas hydrophila, and Aeromonas again, it's like Pseudomonas, Aeromonas, and those combinations are going on. But this is totally a single this thing. It is Aeromonas. So what Aeromonas does is again infects the liver or the kidney, and again the osmotic this thing is imbalanced, and the water accumulation occurs in the abdominal area and resulting in swelling. And if you look from the dorsal side, you will clearly see in case of dropsy the protrusion of the scales. Scales don't attach to the surface of the body, it moves out. So what to do with this fish? And if you ask me, I'll just go for a culling, to be frank. Because initial stage, if you go for a treatment like Epsom salt, I have written 3 grams per 100 liters, you can try very well, you can try with an antibiotic. But all these things I have tried and it's not very effective. And funny things in some YouTube videos and all, we find this green peas treatment also. So you can very well go try, but the best thing is remove that fish and either go for a culling, because it's not a dreaded infection. It slowly passes on. Like it takes within 10 days, one fish goes. Again, next 5 days, another one goes. So the more you keep this fish, it is not going to die. It will transmit the disease. So better isolate or go for it. If you're not that happy with the culling, isolate it and keep it somewhere. And for your satisfaction, you can treat it. And another bacterial infection like popeye and cloud eye, here the eye just protrudes out. And this can be due to an ammonia spike. Increase in ammonia has resulted in this one. pH, a higher pH also results in this one. And like cataract, that whole coating, even the coating comes. So this can also be due to a helminth. Diplostomium can cause. And mostly it is because of the bacterial infection only. So it may be caused due to ammonia, pH and all, and later on bacterial infection. So it is a bacterial infection and you have to go for a bacterial treatment. Now, what to do during a disease outbreak? So what generally I do, this is your system, or it has so much like bacteria or any other pathogen. So if you are going to remove half of the water, if you're going for a 50% water exchange, or I say if you're going for 100% water exchange, some bacteria may be sticking onto the walls, and you can see 100% water exchange, your whole lot of bacteria or the pathogen is removed. But can we go for 100% water exchange? No, because the fish is already stressed and the change in water quality parameters are going to kill it. So I will recommend go for 50% water exchange so that 50% of your problem is solved. And see how much fishes are infected. So if you find like 1 or 2 fishes fish in the whole lot is infected, try to isolate them and go for a disinfection in this tank and treat for a treatment in the hospital tank. So you have to have a hospital tank in that case. And if you are having a filtration system with a carbon, see that the carbon has been removed. Or if you're going to apply any chemicals, carbon it's going to be absorbed by the carbon in the filter. So I prefer a sponge filter. Then know your pathogen and treat accordingly. And there are always we all know that dip and bath treatment are there. And if you ask me what for me, I always go for a bath treatment rather than going for a drip treatment. Anyhow, that I told that it's your wisdom. Like when you're putting the fish in the hospital tank, definitely you can give a dip and transfer it, because dip is going to take less than 30 seconds. You just put in a high dose and transfer it out. Now coming to the treatment, as I told you, go for 50% of water exchange and go for best thing for any disease outbreak. I will tell the best disinfectant and the commonly available thing in the medical shops is potassium permanganate. In all medical shops, it is available. So always make a stock solution of potassium permanganate and treat. And see that never you add crystal potassium permanganate indirectly into the water. So this has been a problem. If you add, slowly the concentration will build up and the fish is going to die. And you will not know when the concentration is going up. So always make a stock solution, then apply. So generally for dip and 10 ppm you can go, or for a bath treatment. This always in all larger ponds also I go for this recommendation, and it has been working. So like 1 gram of potassium permanganate for 10,000 liter of water. So if it is like 80,000 liter of water, you take 8 grams, dissolve in one bucket or around 20 liters, then apply everywhere in the pond. So that is the way you do it. And similar to potassium permanganate, another good disinfectant I can say it's ecroflavin. So the fish which comes from always during transportation, especially from Chennai, what it comes, it is loaded with ecroflavin. So there itself, it's a chemical again, usage is there, but ecroflavin is also effective. So you need to understand, like when we get an injury, what we do, we wipe with Dettol or something. So the disinfectant does that one. Then after that, you have to go for a bacterial treatment, and which definitely is an antibiotic. So antibiotic tetracycline, it's a broad spectrum. Antibiotics are far better, because unless you know it is a gram positive or a gram negative bacteria, you go for a broad spectrum, and tetracycline is fine. It is approved and can be used. So what I suggest is 500 milligram of tetracycline per 100 liter of water. And next day, like we take antibiotics dose 5 days, 5 days, or at least up to 3 days. Similar thing strategy only I am also doing, like 5 milligram per 100 liters of water. Next day again go for a 50% water exchange. Then apply once again this one, and third day again you can go for a 50% water exchange. The good thing about tetracycline, what I have noted is like if aeration you'll be providing, if the dose goes high, always the water becomes very frothy. And if you see a very frothy water, remove, go for 50% water exchange and don't apply anymore of the dose. Let the fish remain in that dosage itself for another 1 or 2 days, and then later on you can go for again 50% water exchange without addition of antibiotics. So up to 3 days you can continue. Then in the hospital tanks, and now we have the human grade and veterinary grade itself. Veterinary grade, it is generally what we get here is tetracycline hydrochloride, and always the dose will be, concentration will be written on the packet itself. Like what we get here is 1 gram of that contains 50 milligram of tetracycline. So you need to apply around 10 grams to get a 500 milligram dose. So that way you have to calculate everything. Now coming to the fungal infection and diseases, how it occurs, it's due to your negligence, I need to say, because always people have a tendency to give overfeed the fish. So we all have appetite, and after that one, what we give, it is going wasted. So next day, if you see a food particle in a aquarium or so, you just have a look at that one. You'll see the hyphae on that one. It's a fungal growth, and slowly, daily you're going to pile up the feed. Daily the accumulation is going to be high. The fungal infection, water mold is going to come, and slowly the pathogen also has to survive. So it will look for new host or new place. And the biggest good thing is that fish is near it, so it goes and attacks fish. And in this also, the fish doesn't die that easily. It takes a few days or maybe 10 days or so. And once it starts dying, the whole lot will go if you don't take things seriously. Then even this can occur when a injury like fungaceous, this spine, when injury occurs on that spine, fungal infection can come. Always unfertilized eggs will have fungal infection. Then these are all its pictures, and clearly you can see the hyphae, the growth, mycelium, everything you can see. And another fungus which causes this ichthyophonous sinuses. This is the internal. The fish consumes the cyst, and internal problems can result. But this is a fungal infection, which is not any external signs we cannot see. Ulcer, eye protrusion are all external signs, but like this hyphae cannot be seen in these cases. And this actually, to be frank, I have not come across. Just for today's point of view, I have taken that one. And we all have been knowing, and so much of research has been done on EUS. Again, I have to say it is due to water quality problem, and even here also bacterial pathogens was also isolated. And but we have come to a conclusion: it is Aphanomyces invadens. And if you write that one, then only it's for those who are in the academics, then only you'll get marks and tell. And SIFA had developed SIFAX, I think it's povidone iodine, and you need to apply that one. So what do you do for a fungal infection? And the best thing in almost all the textbooks is methylene blue, and I also go for methylene blue only, and it has been working. So even for methylene blue, you have to make a stock solution 1 gram per 100 ml, then 3 to 4 drops or 1 ml per liter you can go. And the best in severe cases, always formalin is the best thing, easiest thing to get, best thing. And if you overdose, your fish is going to die. So, and a fish is going to die and it will remain intact. That is it. So formalin, you have to be very, you have to take care by handling that one, everything. So 10 to 20 ppm of formalin is very fine. And I go for a combination of formalin and malachite green mix, and we generally tell FMG mix. So in 1 liter of formalin, around 3.3 grams of malachite green. Both malachite green and formalin are, by concentration goes high, both are very toxic to fish. So be very careful by while using them. And of course, the salt treatment can go. Then parasite diseases, here it can be classified into protozoan, helminth, crustacean, and algae like Udinium. There are also some confusion is there whether it's a protozoan or a dinoflagellate, and it is some textbooks you find it is that. But for us, it's a parasite pathogen, and we have to tackle it. That's all. Then here, if any pathogen like this enters into the body, external parasite, the fish starts rubbing against the tank on hard surface, like somebody is we see the buffalo scratching its body on to remove the ticks, like that. And the fish generally, if it is on gills, they will start gasping because the organism there is going to damage the epithelial tissue. It's eating away the gills, so it is gasping for breath. And generally, you see all these parasite infected fishes, they come near the water flow. So to get more oxygenated water. So they are that loss of appetite, everything will be there. So now if you go by one, protozoal diseases, ick is the most serious thing, and it occurs only during when temperature is low, mostly like around below 28 degrees Celsius, it can come, and it is one of the dreaded thing, and it can wipe off whole thing. And especially with, I've been taking care of marine fishes also, and marine it's a different organism, but cryptocurrent irritants. But it is again same like our freshwater thing. If there is multiples, it is very problematic, and you have to tackle it. And just if you know the life cycle of this, it's a pin drop white spot. As if you spread some salt on the body of the fish, small dots will be there, and each dot is it's a protozoan, it's an organism. So when it takes 2 to 3 weeks for its maturation, and after that during the reproductive phase, it will just fall down from the body of the fish, make a cyst, and this inside the cyst, it goes for a rapid cell division. And after that one, the cyst just breaks. So some tell it is 24 hours. Within 24 hours, it should find a host, and some textbooks it is telling 2 to 3 days. If it doesn't find a fish by the time, all these are going to die. But the main problem here is if you take water, just take water without fish from any aquarium shop or anything. If you have this cyst falling down, and if the cyst is there in water, definitely this again is going to multiply, and it is going to make problems. So never use aquarium water, what you get from shops. And even the plants or everything has to go for a disinfection. Even the plant, on the plants, it can be there. So be careful. And the best thing is increase the temperature to 28 degrees Celsius by using a filter. So what they say is when on increasing temperature, the life cycle of the organism moves faster. Anyhow, 28 degrees has been very effective, and I got the things cleared very fine. So only thing is that the heater thermostat should be pakka. So you have to set around 26 or 27. If the thermostat goes out, some filters which are not as good, like sometimes it will go up to 32 degrees. And see that like ferns and all are not there. Otherwise, in that planted aquarium, they are going to melt. Now, all other this one protozoans like flagellates, ciliates like Ostia Necatrix, Chilodenilla septinae, all this Trichodina. And the main, I will tell only what is the clinical sign. So the best clinical sign is what we see is discoloration on the body, whether it is velvet disease or anything. What happens with this one is they eat away the mucus and the epithelium. So that makes a patch on the body. So it looks like, sometimes it will look like a velvet patch, or it will be a patch. So to be frank, unless you isolate from a research point of view, I'm not worried about that one. For me, it's a patch and it's a protozoan disease or a parasite, and I'm going to treat with that with that angle only. So that is the practical thing. What we have to do. So again, the dinoflagellate, they say if it is a velvet disease, a dinoflagellate, and again, light is not allowed in that one. So for its multiplication, so like these recommendations are there. And another crustacean parasites, that anchor worm. So here around the red, sometimes you have again a red spot on the body, and if you see carefully look at it very closely to the spot, you can see an organism hanging, and it is known as Lernia, the anchor worm. So the head is attached to the body. It's hold tight. So even the best thing is try to remove it, because I have tried many medications and all. The fish may die, but the anchor won't die. So it's a very stubborn thing. So as far as possible, if you see it, try to remove it. That is the best possible option. You can leave a salt dip so that it gets little bit loosened up, and you can easily pluck it up. And then next is the fish lice. This is quite you can control very easily. Like it has a natural enemy or natural predator, I need to say. All the barbs in general, like what in Malayalam what we say, parallel everything, all those in natural. So natural bodies, if you have a barb or a thing, it won't be there. And our specialist in aquarium is also always, I tell, it's a rosy barb. So rosy barb, it will eat. And when does rosy barb eat? This Arbulis is not like anchor worm. It doesn't. It gets attached, and it will after some time it will move away from the body and try to find another fish. So when it moves through the water, our rosy barb eats. And similarly, larger crustacean parasites like isopods, we have it's a problem in cage culture system. Then we have helminth like Gyrodactylus and Dactylogarus, and based on the number of hooks it is used for attaching, it is all this microscope is required to know what it is. But generally, for a helminth infection also, the gills get a little bit swollen gills. We can see it just coming out. So that is it, and you can go for its treatment. And most of this helminth, like worms, they have an intermediate host. Some have, some don't have. So as far as possible, if you keep snail or anything like that, sometimes some intermediate for snails, some helminth have snail as an intermediate host, and some worms have even fish as an intermediate host. So it's always see the compatibility, and I don't prefer putting so many snails in my tank unless you have like assassin snail, which is of useful, you can put. That's all. And they again lay egg, and they have a free swimming larval stage. So always be very particular. If you take water without disinfection, even water can make a problem. All these things can enter, and all these things make problem when the water is polluted, and to say water quality was poor. So treatment again, you have the salt treatment. I was telling 0.5 gram per liter is fine. Like when you use in a quarantine tank, or when you introduce a fish for osmoregulatory thing or a stress reliever. But when we go for treatment, at least 3 grams per liter it should go. So this has to come 3 grams per liter, then 2 to 3% like that. So even for salt tolerant fish like guppy and all, guppy, mollies and all, you can go for 3 grams per liter. After 6 hours, again 3 grams per liter in the same water. And after 6 hours, again 4 grams per liter. So up to 10 grams, 10 ppt salt it can tolerate. And here also for against all this protozoan or parasites, the formalin has been working very fine for me. Only thing is, after application of formalin, just take the pH also. Have a look at the pH. So this is 3.3 grams of malachite green in 1 liter of formalin. Then always some text says white spot. Some people say potassium permanganate is fine, methylene blue. I need to tell any chemical what you're going to use, it will have some benefit, because it is going to act. And even if you take a textbook and see the treatments, you will get everything, potassium permanganate, methylene blue, everything. It is written blah blah blah, it goes. And even like for crustacean parasites, organophosphorus compounds like trichlorophene. And they tell it degrades very fast, so it is safe. Like within 2 hours it degrades at a pH of 8.5. And of course copper sulfate for marine white spot, it is very effective. But for me, I have burned my fingers many times using copper sulfate. It's very tough. Like little bit the concentration goes high, the fish goes. And later on only I came to know that you have to go for a slow addition. Even at this dose directly I applied, and I lost my fishes, I need to tell that. So be very careful when you use copper sulfate. Then we have so many commercial products like in Amazon, Flipkart, everything you will get. And most of the products, they don't give what is the active ingredient or the chemical component in that one. But one, I was very happy to when I searched, and this Bionil, they tell it's proven effective against all pathogens, bacteria, virus, fungi, protozoa. And if you look what is inside, it's definitely formaldehyde. And we know that if you apply formalin, I don't think any bacteria will be there. So glutaraldehyde, this combination is a very strong thing, and it will clear off almost all things. I am not used, but it should work. And we have hexameter, hole in the head disease. Again, the exact positive agent is not very clear. The hole like things, it generally comes for Oscar and all. Then these are all due to internal flashlight infections. Then the wasting disease, all they tell it is protozoa, TB, can be due to TB. Or when you see a white feces hanging, it's definitely an internal parasite. So white feces hanging, it's a problem, and the fish is going to get emaciated and it's going to die. So be very careful, and you have to go for a medication immediately. And the best thing is use metrogel tablets, 400 milligram per 100 liters. It's available for. And for aquarium fishes, you don't need to worry. You can use directly, because the water is not going to go away. And here again, like what we do in tetracycline, don't go for consecutive 3 days dose. Fish is going to be stressed and it is going to die. It is going to die. So apply metrogel at this dose, 400 milligram, one tap for 100 liters water. After 1 week, go for a 50% water exchange. Again, add one more. That is enough. And similar is the case with albendazole, and this we have to go for. Repeat again, while adding, always go for a 50% water exchange. And we have this products, APIs, general cure. All these things have this whole thing, all the what all pathogens I have told, parasites I have told, it is written on that one. It gets cleared off. Worm out for internal again. Maybe the content is maybe the same. And now coming to the last portion, like viral diseases, and of course viral diseases, we say we don't have much treatment for that one. Like best management practices, keep the water clean. That's all. But here again, koi sleepy disease, sleepy disease, I need to say, or sleeping sickness like that. The fish just lies below the surface, and it will be be straight. And after some time, if you touch also, it will just float away. So it's a very problematic thing, and it's a viral infection, and it has to be taken care of. Like koi herpes virus, another thing is that. Then in tilapia, we have tilapia lake virus with all the symptoms. Again, here also the eye puts out, swelling of abdomen, then curved peduncle, all these things are symptoms. Then this slide, I need to tell, it's a food for research, I thought for research. And here it has confused me a lot, because I had a problem with anabas fish having this cauliflower, like typical cauliflower-like growth on the body. And after going through and talking to my teachers and experts in the field, they say it could be due to lymphocytic, because we are not going, we didn't have an isolation or so. It could be due to lymphocystic disease virus. And it's a chronic infection, it is written. So like chronic infection, it takes time. And to that point, this is very true. The fish was not dying, it was surviving and moved on till the end of the crop. But what the appearance, everything is lost. So, but at the same time, from a renowned speaker, I came to know like the problem I was having in Gaurami, that sir was telling it is due to LCDV. So I'm confused there. Again, you have this pox virus, and the first picture which I showed, maybe I was till now I was thinking to be Columnaris, and but the pox virus also has the same symptoms, the white waxy growth. And if this, I don't know, we have to exactly check what is the problem. But this is a dreaded thing. It comes, it goes away. But if you look at the literatures on pox virus, they are telling it's not that problematic. And but for me, I don't know whether this is pox virus or this thing, LCDV. It's a big problem, and it clears off. If you don't treat it, it clears off the whole lot. So treatment is nothing, but we go for a 50% water exchange, and thinking as viral disease, we don't have much treatment. Thinking taking this to be a bacterial infection, I was treating, and in most cases, fish was getting cured, unless it's a very severe infection. So again, non-specific treatments. And again, due to water quality. So all the pathogens we have finished. And now coming to the environmental parameters, we like PACU, some say the lips get protruded out. It's all due to water quality problem that because of low DO, this aquas have that pits, and for this adaptation, it moves out. So when you give good quality water, within 6 hours, the inner lip goes inside. So again, people are very much worried about the alkalinity here. But what effect does alkalinity have? It has effect has on pH. So always it is there that it's a desirable alkalinity level should be there. But as a farmer, I need to tell, like, you have to have a look on the pH always, especially with the filter on. Your pH can go down, so always take the pH, and that too with a solution. I'll just find it. And here also again this tumor, cancer, and all. And this was an interesting experience for me. Like I saw a 8-year-old Arona. The father of the school just called and told me it's my Arona's stomach is bulging out. So what I thought was it's dropsy. I told it's very difficult, any of other LC. Then he sent me a video. Then from the video, I could just know that it's all the scales are intact, so it's not dropsy. So again, I went, and the father was very much interested, and he told he happened to be the father from where my daughter is studying. So he didn't know me, but I went there, and later on I was thinking it to be a tumor, because this experience I had when tumor is there, they again this water accumulation occurs, and wow, the best thing you can give is anesthetize the fish and remove the fluid from the that area. But within 2 weeks, again, it is going to recoup. So there is no, we cannot go for a surgery. It's difficult because if it's an internal organ, it's going to be a problem. So here in this case, I gave anesthesia. I went and tried. As soon as I hold the lamp, it was like rubbling sounds was coming. So I wondered what it is. Then it was clear that in the tank, father also had this doubt. In the tank, they had put all these round, smooth pebbles. So, and they were giving goldfish as feed. So when the fish was eating the goldfish, without its reflex action, the stones were going inside. And I removed around 21 stones from this fish through its mouth itself. And the fish is very happy. It's going on around 8 years, and I hope it will live more. Then again, we have this other type, like vitamin C deficiency. It's like curving of the vertebral column. And if you give a layman or somebody person this fish, I will tell it's a fancy guppy if I don't know. Because it's cooked to a special shape. So you should know what it is. And it can be a genetic deformity also, which can be carried out to the next generation itself. And we have the Fungal disease. And here also, I've seen many videos of Dr. Lowe. And he has taken that you correct exact area. He punches the he removes the bubble from that one. So swimming imbalance can be there. So these are all like accidental intake or that one. And I'm working in a spices research institute, and there always in IRC or anything, I always come across two main problems. So one is rhizome rot in ginger, another is this one, Phytophthora foot rot in black pepper. So this has been like, but my understanding is always like, there should be a pathogen, then only disease will be there. So what I did was, when I set up an aquaponics unit, I used these two crops in that one. Even in raft system, I used, because the media was sterile. In water, you don't find this organism. So easily, even waterlogging is the main reason for Phytophthora outbreak. But here in water itself, I could grow a pepper vine. And similarly, in waterlogged condition, I could take ginger. Whole lot of, so the whole idea is what, so the idea is you need to have a pathogen to cause a infection. So if your media is sterile, it's going to solve your problem, but the pathogen can come through your fish also here. So it's good that you use a UV sterilizer or something like that, but always your pathogen can be there in the fish also, but it's a safer side. And how to prevent fish disease, always go for a quarantine. I need to tell now, everyone is familiar with quarantine. Go for 15 days, like white spot and all. It takes around 15 days for the outbreak to occur. Then this all disinfect the fish before stocking, and all other things I have told. Avoid overcrowding, handling, and all. So this again, it's mentioned. Disinfection, it is best you go for a potassium permanganate disinfection. You acclimatize the fish properly. It's a poikilothermic, so you have to take care of the acclimatization of the temperature and the this one also. pH and other water quality. Mix both water, and before you release the fish, you can go for a potassium permanganate dip, like 20 milligram per liter, 20 ppm potassium permanganate. And even you can go for a simultaneous dip with sodium chloride also. But the dip time should not increase. Just hold all the whole lot of fish in your net, dip, take it out, dip, and put in the next one, and put in the tank where you are going to stock the fish. So this is that FEO, they have a diagrammatic pictorial representation of how you have to go for a dip treatment. Then I need to tell like some of the farmers, even in our like we always tell if you are going to stock fish in a larger pond, you go for a hopper rearing. But I always prefer a pen system. In case of hopper, the farmer don't know that this net is going to clog. So the whole, like suppose for a 10 hectares thing or even for a 1 acre pond, he has taken the fishes, and he is going to put whole lot for acclimatizing to the feed in this hopper. So if you like if you don't brush the hopper like for 1 week or so, this have a algal growth on that one, and there is no water exchange through the this one. So you have a problem of DO inside that one, and the fish, whole lot of fish will get infected with some pathogen or the other. So always, if it is a clear pond, go for a pen rearing system, pen type hopper, and release the fish within 15 days, even if it is shrimp. So that we have to be very careful, and that I told like unnecessarily don't go for chemicals. If you are going for chemicals, you will end up in a problem. And salt, everything, these things has to be taken care of, then it's fine. And another thing in hopper, if you are going to put fungaceous, I have seen many times the spine of the fungaceous get entangled in that, and later on you have to break the spine, and there again infection comes. So that's it. Again, only one key thing is that if you put your water clean, you can solve most of the problems. So always this, again, I always tell like goldfish is not suitable for a bowl. You have the choice of the fish you have taken is the problem. If it was a fighter, you will end up happily. But here you can maintain the tank fish in the tank, but you will always have to work, and at the maybe by 1 month you will end up losing the fish. So choose the fish properly, give it proper water, and the fish will make you happy. That's all. Thank you.
Thank you, Pradeep, for that very interesting and very, very practical information that you've given us. For the rest of the participants, please, Deepak has put the feedback form link. Kindly do give us your feedback. And I think we are open for discussion now. So anyone with questions, either you can type them into the chat box or you can ask Pradeep directly.
Excuse me, ma'am, I had a question. If I
Please,
can
go
ask
ahead. Can you just tell us your name?
Yes, ma'am. My name is Shaurya Datta. I am from CFS Gumla. So I had a question that what is there a possible consequence of the death of gut bacteria in fish? Is it possible if we treat the fishes with these methods? Is it possible that the gut bacteria dies, and what are the possible consequences from it?
Like your first thing is to treat the fish, and gut bacteria, for me it is secondary. You can use a probiotic to recover it back. So when your fish is going to die, first thing what I will do is to cure the fish. So other things are not because this thing that is what I am telling. This person from extension side and from a research side may be having a different opinion. For us, like when a farmer reports that this problem is there, we have to go for it. Suggest him a treatment. Otherwise, he won't feel happy, and the fish also is going to work. Definitely, all chemicals will have some action or the other. Even if when we take antibiotics, don't you forget about fish. You take an antibiotic continuously for 3 days, you have all your stomach gets upset. That's all. So that's the answer for that one.
Thank you, sir. That's where my question actually arrived. What else from?
Yeah, but you have to go for it. If you wait for like your gut to get all right without taking an antibiotic, you will end up. So that's it. Thank you.
So there could be a case for resistance as well. The bacteria which you're treating gets resistant to the
that's what
antibiotics.
I told, like, don't go for any antibiotic, indiscriminate use of antibiotic. So the safest thing is tetracycline for us. Initially itself, you think that a bacterial infection will come and you go for tetracycline or any antibiotic. it's going to make a problem. So don't go for any antibiotic treatment unless you find you find it is due to bacteria, you go for antibiotic. Otherwise, no. Even this feed, you can use in feed also. Initial, I didn't mention that one because that's again in ponds. If you start using antibiotics with feed, it's like in a small system with high stocking density, always closed system, it is fine. But if you start using in a pond, then again environmental issues, all those things, bacterial resistance will come. So don't use it, because in bigger system always like some fish will be active, they'll be taking. So by that way, giving through feed, it is fine. So that also 500 mg per 1 kg I normally use, but don't recommend. I don't recommend to farmers.
Okay, thank you, sir.
Then even other natural things are there, like same antibacterial effects. Always these herbal products we need to set. So many herbal things are there. You go for a turmeric, then for in case of internal infection, garlic is found to be effective. There are many plant extracts or something like that. So all those things, but exact dose evaluation, you will get so many literature. But for a mild infection also it is fine. But when it's severe, for a mild infection, don't get hurt. For mild infection, we can go for Ayurveda or something. But when it comes to a surgery type of situation, we don't go. We have to go for other this thing. Same case.
Okay, sir. Thank you, sir.
Sir, myself Dhanaji Patil, and I have, sir, one problem with aquaponics, sir. What happens, sir, in aquaponic system? Somewhat feed or any fecal matter, it is not decomposing properly. So can you suggest any prevention method for disease prevention method for aquaponics, sir?
Yeah, aquaponics is very. I have been practicing aquaponics when the system had come, even the high density farming and all. Aquaponics and biofloc system, you have to quarantine the fish before before stocking. Don't stock the fish initially itself, because your whole area is going to be get problematic, because the gravel you use, everything. Once a infected fish comes, like the water has, we give the water circulation for 15 days. Cycling period is there. And in that case, the biofilm formation will be there. And if you have an infected fish, definitely in that biofilm, this bacteria is going to be there. So always, even after the treatment, everything, always you will have a chance of getting this infection. So for best thing for aquaponics and biofloc, you have to go for a quarantine tank system then only. And the water quality is deteriorating, you said no. It is mainly because the actual essence of aquaponics nobody has been taking. So if the stocking density, everything, the practical way when you do it, you get a standardized thing. So what I asked for me, like even if you put a one barrel with a filter, 200 liter capacity, and you plant plants, some in pots, that is also aquaponics system, isn't it? So in that you have to go for a stocking density of 15, 20, it is fine. But the actual recommended stocking density of aquaponics can go up to 100. So when you stock 100, you need to have a very good filtration system. And apart from that one, you should go for a sedimentation tank. And even in when the water falls into the gravel bed, there also, if possible, put a filter, that bucket type thing. So actually speaking, like for 1 cent of pond, you need to have around 2 cents of vegetable beds. Then your problem. So most of the people don't follow this and end up in problem. So we have to be careful.
Okay, thank you, sir. Can we apply, sir, probiotics for a better?
Definitely. Probiotics every time you can apply. So many gut probiotics are there. Commercial probiotics are there. And only thing is that, I tell to farmer, don't go by these advertisements. So if a farmer tells like this, I have been using and it is fine, then that is fine. Otherwise, you will have so many, because during my PhD itself, initial phase, we had done this work analyzing different probiotics. And we found that what they mentioned never is there in that one. It may be a rava powder or something like that. So trusted probiotics, definitely it is useful. It will help.
Okay, thank you, sir.
Sir, my name is Rishikesh Pawar. Sir, for the ciliate infection, what need to be done in a marine aquarium tank?
Now, actually, I go for quarantine, and recently I used copper sulfate. And recommended thing what you see is white spot is copper sulfate. And I told no, twice I used copper sulfate, and both it was not effective. And then you have to go for, I told no, 0.15 ppm. That too. In recently for today's presentation, when I went through some different literatures, I found that 0.15 ppm itself, you cannot go for a sudden dosing. You have to go for a slow dosing. Maybe so. It is very crucial. Then, if you from my experience in white spot, normally this flat type fishes they will get. So as soon as you find a fish with that one, you isolate that one. So you can at least make other things away from this white spot. And another thing they tell, around 28 degrees Celsius, if you put in that, the cycle moves faster, like that. But recommended thing is always copper sulfate if you look in any textbooks. But I had problem. So presently I don't have an answer. Maybe after sacrificing few more fishes, maybe I can tell. That's all.
Sir, one more question for the in the biofloc. If some disease problem happen, what it means, how it has to be treated? Means we need to exchange the water and remove the flock, and then we need to treat the fish.
Biofloc is very tricky. You cannot use antibiotic or something. So always go for a quarantine. Go for preventive measures. That's all. And you have to see how much is the flock density and all, like aeration, everything. Try to improve the water quality. Maximum, if you are going for a 50% exchange, also it will take the flock again. It has to, it will crash, and have to maybe see what infection it is. Then normally I recommend turmeric, and if it is so severe and no other way, you can go for an antibiotic treatment. Not in water, because you don't see a biofloc problem is you don't see the fish also, because the water is turbid. So I always prefer a aquaponic system and compare. If you have an area, I prefer aquaponics rather than biofloc, because in biofloc you don't know what is happening inside. Even if a fish, if it is going to die, also it sinks down. After it is dead, around 6 hours or so only it comes up. So always it's difficult to monitor in a biofloc system. Quarantine the fish and see that the ammonia doesn't go up. Look at the water quality parameters. That's all.
Thank you, sir. Sir, I wanted to ask about the ciliate infection in marine aquarium tank. What is happening once that ciliate infection happens, even after cleaning or water exchange, and it occurs after some days, like after a few months, it occurs again. So for the ciliate parasitic infection, what need to be done?
I told you all these ciliates, they have this one. They will, after forming this, they for reproductive phase they have to fall down. So when it falls down, definitely it takes 2 to 3 weeks for it. Once it falls down, that within the cyst, the cycle is very fast. So maybe in cyst form it is there. You for a complete cure, you will have to go for a disinfection.
Thank you very much, sir.
White spot only you are mentioning, no?
Yeah, earlier white spot and that, sir, that ciliate problem, once it occurs in a tank, it remains continuous.
If it is again and again occurring, then this is the problem. You have to disinfect the whole thing.
Thank you, sir.
So recently I had shifted all the fish. This time when I got the new lot of fish, I didn't go for a copper sulfate treatment. I was monitoring it because I was not that this thing. So I removed the fish itself. When initially I had the doubt, I removed the fish from the tank. And a bare bottom tank, it is fine.
Thank you, sir.
Hi, Pradeep. I have a very general question.
Yes.
My question have 2 parts. Okay, part A. There's a huge range of things you have talked about, and there are a lot of chemicals here. But there are situations you put these chemicals in a quarantine tank, like hospital tank, or it could be you be putting them in the actual system itself. So when do you decide actually to go for one way or either? That's my part A question.
When do you decide, actually, last point I didn't get. When do you decide?
Yeah, like we did decide whether you apply the chemicals in a quarantine tank or you do it on the actual system itself. Well, or like how you take the decision.
Yeah, that I'll tell. Okay, fine.
Yeah, second part, the part B will be if you are actually putting chemicals into the actual system, would it be affecting the beneficial bacteria in the filter if there's, if there's a biofilter, it be killing the good bacteria as well, so yeah.
Yeah. So as far as possible, don't go for chemical treatment. So that is what initially I was telling. You have to go that wisdom part you have to take. Like if some fish is dying, not dying, if it is already dead means it has a problem. And if it is dead and if it has remained for some time in the tank, then obviously most of the fishes will be infected. So would have got some. So first thing you go for a water exchange and see. Then secondly, when if it is very problematic, you can go for a dip treatment. And the last way only I'll go for a treatment. Generally, I go for formalin. And definitely the bacteria in the filter, everything is going to die. That will die. So it will take some time for the system to again come back. And if it is the fish is very weak also, if you go for a harsh chemical treatment, it's a problem. So generally, I go for mild disinfection. For me, potassium permanganate, this is fine. By second day itself, if you apply potassium permanganate in tank, by second day itself, you will see the discoloration. The color of the potassium permanganate would have changed. So that means the chemical is degrading in that one, and the system gets back soon. So my main thing, what trump card is, I use potassium permanganate. That too, when it is very severe. Filters, definitely this problem will be there. So that is why generally for treatment now, when even in aquaponic system, you just give the aeration. That's all. You cut off the filter. Even if it is aquaponic system, in that case you have to cut off the filter. Then and that way also in that two thinkings are there for me in that one also, because your bacteria also already has circulated. So if we are going to circulate the whole tank, that some amount of bacteria which is there in the gravel system also is going to die. So that if you are going to circulate, it gives that plus point. And if you are putting this through that, again beneficial one will die. So it's all again thought for research, which is better.
Yeah.
Generally, I close the tank and I'll go for a disinfection in this one only, in system only. That other part, gravel bed, I won't disturb.
Yeah, I think there are two thoughts coming to my mind. Yeah, I mean, if you are actually treating the system itself, and we know if it's going to kill or affect our bacteria in the filter, then even if the fish recover, if the bioload is too much, like if there are too many fish in the system, then also it's going to affect them by having more ammonia spike or something, because obviously there's no good bacteria in your filter. And if you cut off your filter, again, that's again going to be all the the filter itself is going to be anaerobic, and probably that also will kill the bacteria. Yeah. So yeah.
Correct.
Anyway, thanks.
Yeah, anyone else with a question? I don't think so. So I guess we'll stop the session for today. Thank you, Pradeep, once again.
Thank you so much, Deepak, for giving us this platform.
For giving us so much valuable information and spending time with us. Thank you, and we may call you back again. Thank you.
Thank you so much. Bye. Thanks a lot.
Bye. Bye.